I'm Dr. Andrew Brandeis, the founder of the Intestinal Repair Protocol. I want to give you a little intro to the protocol so you can decide if it's right for you. First, I should give you a little intro into me. I'm a licensed naturopathic doctor in California. Most people don't know what a naturopathic doctor is, so I'll tell you. In terms of my training, I had 4 years of medical school plus a residency. And in terms of my practice, I can prescribe pharmaceuticals, order lab work, make diagnoses, and everything that you would expect from a family practice medical doctor. I have 8 years in clinical practice in traditional urgent care, where I treated everything from, say, urinary tract infections and migraines to complex chronic illnesses such as irritable bowel syndrome, Lyme disease, etc. I want to tell you a little bit about my story because it's pertinent. When I was in high school, I was diagnosed with irritable bowel syndrome, and I had a host of treatments from doctors that didn't make any sense, and their explanations never made any sense. And I'm sure that it's that experience that led me to want to study medicine. And in practice, I was my first patient. So I tried all kinds of treatments that I'd heard of in school and from my colleagues, and over time sort of refined a protocol that eliminated all of my symptoms. And then I started taking what I learned and applying it to my patients, and we just had tremendous success with a lot of people. So over time and over thousands of patients, I've refined this protocol into what I'm calling the Intestinal Repair Protocol, and I'm offering it now online for anybody who is suffering from conditions that could be helped by this. They can do it at home without having to fly to California and make an expensive visit to come see me. So how do you decide if the intestinal repair protocol is right for you? If you're suffering from either diagnosed or undiagnosed conditions such as, say, diarrhea, constipation, these are conditions these are actually symptoms that are also diagnoses. It's good to understand the different kinds of diarrhea so that you can know if you're really on the right path here. So let's talk for a second about acute versus chronic diarrhea. Acute diarrhea is something that only lasts about 2 weeks and is usually self-limiting. That's not what this protocol is for. This protocol is for people who have diarrhea that lasts for, say, more than 3 weeks. It may be relapsing and remitting. It may alternate with constipation. It may come and go over years. So if that sounds like what you're experiencing, then the intestinal repair protocol is definitely something for you. Let's talk about constipation for a second. There's different definitions of constipation. Some people think that 1 to 2 bowel movements a day is appropriate, and other people think 1 to 2 weeks. I definitely think that you want to be moving your bowels at least once a day, and if you're not, we should consider that constipation. So if you're not moving your bowels at least once per day and you're finding that it's leading to you not feeling well or symptoms of fatigue or mental fogginess, things like that, you definitely want to consider doing this protocol. Or you might just be suffering from gas and bloating after meals. You might just feel like something's not right and that you could improve and your health could be better. If that's the case, this is definitely something you want to try out. And then there's diagnoses such as inflammatory bowel disease, which would be most commonly Crohn's disease and colitis. Even if you're suffering from a diagnosis like this, that a doctor has given you a treatment and you know what your plan is, if you feel like there's more and you want to have fewer flares and you want to really restore the damage that's been done to your intestines over time, then this is definitely something for you. And lastly, irritable bowel syndrome. As I said, this is the diagnosis I had, and this is what's known as a diagnosis of exclusion, which means we don't really know what's causing this or what's going on, but you have a constellation of symptoms that fits into this category, and we're going to call that IBS. And if you have IBS, as you know, there's not necessarily good treatments for you out there. So you might have tried various different treatments from either doctors or things you read online and maybe even had some success. But if you're feeling like there's still room for improvement and you want to eliminate these symptoms and you want to have a healthy gut where you're no longer experiencing any of the IBS symptoms, then you definitely want to do this protocol. So what is this protocol I keep mentioning? I'll tell you a little bit about how it works. So As I said a minute ago, even if you've had like every test in the book and all other diagnoses ruled out or ruled in, there's still hope. And what I mean is that I'm very familiar with some specialty labs, and I know how to look for things in the gut and how to do specific testing and interpret the testing that other doctors who don't specialize in this just might not be aware of. So even if a doctor gave you a specific diagnosis, it doesn't necessarily mean that it's true. And in this protocol, we'll work towards finding the appropriate diagnosis. And in terms of treatment, how do we approach the repair of the intestines? It's very simple. We follow just a few steps, as you can see here on the screen. So the first step is to address stomach acid levels. There's a major misconception that too much stomach acid is causing a lot of problems for people. So we figure out what your appropriate stomach acid levels are, very simply, and then we treat that as needed. The second step is to actually rebuild the lining of the intestines. So this is where millions of cells and bacteria that are really digesting your food for you, this is where they all do their work. And if there's a lot of damage there, you're going to feel sick and you're going to have symptoms until this has all been repaired. The third step is diet and lifestyle modifications. So there's some very simple things that you will likely need to do to either eliminate things from your diet that we know are causing harm, or more simply just add in a few things to your diet that we know will improve the situation. The fourth step is to eliminate any infections that may be present. So I said a minute ago that there's specialty labs that know how to do specific testing. So imagine you might have an undiagnosed parasitic infection. Maybe you've been tested for parasites and it came up negative. It may be the case that you have a fungal infection or a parasitic infection that needs to be addressed, in which case we will schedule an online visit, we'll do appropriate testing, and treat with either an herbal protocol or pharmaceuticals as necessary. And lastly is the maintenance period, which is just once you've restored your gut and all your symptoms are resolved, we want to make sure they don't come back. So there's very simple things you could do, to maintain this once everything's all back to normal. So that's the intro to the intestinal repair protocol, and I hope it makes sense, and I hope it seems that it's very simple and easy to do, because it really is. As I said, this is something that I myself suffered with for years of my life, and I know that these symptoms can be really hard on your life, not just having these symptoms, but also just feeling tired and fatigued and lousy all the time. So if this resonates with you and you feel that this is something that you could benefit from, I really encourage you to go on to the next video and walk yourself through this protocol so that you can experience life without any of these symptoms. Thanks so much, and I hope I see you there.